Coming up, we'll be on location at the International Spine, Pain, and Performance Center with locations in Washington, D.C. and Arlington, Virginia, discussing the latest advances in pain medicine and how they can minimize and even eliminate pain and help you return to your active and healthy lifestyle with one of this area's top doctors, Dr. Mehul Desai. We're at the International Spine, Pain, and Performance Center with Dr. Desai talking about some of the latest treatments in pain management. And there are so many different treatment options that have evolved over the years. There's many advancements, so we're really honored to have you with us, Dr. Desai. I wanted to welcome you to the program.
Thank you very much for having me.
All right, it's our pleasure. Can you please begin by telling us what pain medicine is and how it works?
Pain medicine is an interesting specialty. It's evolved over the last 40 to 50 years as the need for pain medicine has increased. 1/3 of Americans suffer from chronically painful conditions: headaches, arthritis, low back pain. Really, pain medicine, though, is a combination of various specialties that really take the time to get extra training to be able to help people with those painful conditions. It's a really broad specialty that includes everything from coordinating care, like coordinating physical therapy, all the way through to cutting-edge interventional procedures that can help people avoid surgery, reduce disability, and reduce their need for pain medications.
So it seems to be an area or modality that really covers a wide variety of types of injuries and pain and gives many options to people that may be suffering from injuries. What are some of the latest treatment options or the most effective treatment options?
So absolutely. I think that, historically, we called ourselves pain medicine specialists. Increasingly, our practice is pain medicine, the care of complex spine conditions, orthopedic issues like knee pain, shoulder pain, hip pain. It's really expanded considerably as there are more technological advancements. Specifically when it comes to new and cutting edge options, I think everything from coordinating with physical therapists, really understanding what kind of needs the individual patient or client has to make sure they get the right kind of physical therapy, to understand that the evidence for things like physical therapy is constantly evolving and improving. Also, we now have a lot more minimally invasive procedures that we have access to. And as we gain more access, patients get access as well. So it used to be that between physical therapy and surgery, there weren't that many things that were in that area. But we continue to develop new technologies that can help people with things like lumbar spinal stenosis, with chronic pain after back surgery, all the way through to options for people who hurt themselves just yesterday. So knee pain, hip pain, shoulder pain that happens after weekend warriors get injured. There's a lot more options, especially as we start looking into the biological side of things. With the developments in stem cells or stem cell-like products, there are now just a whole host of options that are available to people that weren't available as recently as 5 years ago.
So you're really utilizing a comprehensive approach, not just to treat the injury or whether it's through surgery or minimally invasive surgery, but also to provide physical therapy in every aspect to get people back to their active lives.
Absolutely. I mean, the way I look at it is not every person who comes to see me needs an injection or needs a procedure. Many of them just need help understanding what's wrong and understanding what their options are. Oftentimes, simply guiding them with regards to what they can do next is really what they're looking for rather than a really invasive approach. And that's been part of our process, is that we look at ourselves as members of the community and as an opportunity with every visit to help educate people about what their options are.
So you're really working as a partnership with each patient, taking the time to understand exactly what issue they're dealing with and prescribing or putting together the best treatment option or options.
Yes, and I think one of the things that's been really important to me is, as we put together this practice, is really considering the patient experience. Not only having access to cutting edge care, but really understanding how challenging it can be to be a patient, to navigate the healthcare environment that we're all living in these days. So we look at that each and every time we see a patient and hopefully come up with a treatment option that's unique and specific to that person's needs.
That's all to the patient's benefit.
And that's what we're hoping for.
So Dr. Desai, what types of problems do these treatment options typically address?
So, there's several different groups of options that or several different groups of problems that we typically see. We see a group of patients that's a little bit older that has degenerative disease like osteoarthritis or things of that nature. And then we also see a much younger group of patients that has problems that are much more related to activity. So a lot of people these days spend the majority of their time sitting at work, and then they go exercise pretty actively. And some of those things can provoke pain. So what we're seeing a lot of is young people with problems that are related to posture, that are related to tendons, ligaments, and other kinds of injuries that happen when the difference between what you do for work and what you do for fun is really broad. The other group of patients we're seeing is a little bit older, and they tend to have problems that are related to osteoarthritis and things of that nature. We also see a lot of patients with headaches, and interestingly, we have a small group of patients that we see that have pelvic pain, which is an area that often is underserved in the community.
So you're really covering a wide variety. I mean, you can help pretty much most people that are dealing with different types of pain, whether it's through an injury or some type of sports activity, or just, like you said, neck pain or back pain. And it's really comprehensive. And what you do is pretty much focus on and customize the treatment for each patient, I take it.
We try to do that. And I think one of the things I take a lot of pride in is for every one patient that I see that has a fairly straightforward or simple problem, at least from my perspective, although everyone's problems are not simple and straightforward to them, we also see a lot of second and third opinions where people have seen many, many, many other providers in the past and are really looking for someone to put things together for them and try to help them in a way that no one else has been able to help them. And one of the things we're most excited about is that we now also offer nutritional services. So we have patients who can see a nutritionist who can also do some genetic testing to determine what kind of diets are best for them based on what they're trying to accomplish, whether it's performance, whether it's weight loss, or whether it's just managing their diabetes or kidney problems. In addition to that, we have yoga and Pilates here. So there's a whole host of options that are available for patients in one location, in one place.
That's awesome. I think that's a great benefit to patients because not only do they get treated then, but you also provide the preventative and the physical therapy to strengthen and keep them in really good condition as well.
Yeah, I think that's a great point. I think increasingly we want to look at prevention. How do we help people prevent further injury? How do we help them prevent further relapse or recurrence? And I think that's a big part of what we want to do is to look at folks and determine what we can do to help them not only get better now, but stay better.
That's a wonderful approach, and again, to the really great benefit of the patients. So, Dr. Desai, what are some of the newer procedures that you're offering or that are available for patients these days?
So I think we've been very fortunate. In our practice, we also do clinical trials, and at any one time, we're doing anywhere from 5 to 8 clinical trials, which gives patients access to new and cutting-edge technologies all the time. One of the things that we do that no one else in the area is really doing is we do minimally invasive procedures for spinal stenosis. Lots of patients who have spinal stenosis end up with only very few options, a very large, very invasive surgery that often can result in prolonged recovery times. We do a procedure that's 20 minutes in and out. You don't have to stay the night in the hospital. It's a small spacer that goes between the vertebrae, and patients can get relief immediately upon awakening, and they can save themselves from the recovery time and the risks of more invasive surgery. Now, not every patient's a candidate for that. Some people need the more invasive surgery, but for those who really are looking for alternatives, that's one really great option. Also, increasingly, we're doing a lot of procedures under ultrasound. We've got an ultrasound machine here behind us. It allows us to visualize things without radiation right in the office. We can see nerves, we can see joints, and really gives us better visibility of these structures so that we can do procedures when needed in a really convenient, time-efficient manner and make it as painless as possible whenever possible.
I had mentioned you offer a lot of state-of-the-art technology. People or patients that are coming to your practice don't really need to go out or to other practices or get referred out or go to hospitals. You can pretty much do everything right here.
Yeah, the vast majority of what we do from a procedural perspective and from a clinical perspective is done here right in the office. We've got an ultrasound machine in the office, we've got an x-ray machine in the office, really allowing for greater efficiency because everyone's time is valuable. People come to see us and they've got jobs, they've got other things on their plate, and they want to have an experience that's efficient, that's effective, and also helpful. And I think we're able to provide that by keeping everything under one roof. We do some things in the hospital when necessary, but the vast majority of what we're able to do is right here, and it can be really done quickly.
People are really busy, as you know, busy professionals, and they don't have a lot of extra time. So if you can keep it as an efficient process like you do, they can come to one practice, get the diagnosis, get the treatment, even the physical therapy and the wellness, nutritional advice as well. It's a huge benefit, again, to the patient and saves a lot of time.
That's what we're hoping for. I think healthcare continues to evolve. The pressures on healthcare are tremendous, and the pressure to make sure that we're able to help people in multifactorial ways is also increasing. I think what we're doing is planning for the future, and the future is taking care of people from A to Z, not just the one little part that you necessarily have a specialty in. One of the things we've recently introduced to our practice is every one Wednesday a month, we all get together as clinicians and we talk about challenging patients, new advancements, and we really have a comprehensive discussion about things we can offer to our patients, but also look at patients that haven't gotten better and see if there's someone else has a tool or a trick that we can use that might be able to be helpful.
It truly is a practice model that is of the future. It's cutting edge technology, it's comprehensive, and really patient-centric.
No, that's what we're hoping for.
That's great. What are some of the other treatment options that are available to help patients dealing with pain and injuries?
Well, one of the most exciting areas of development, and an area that I get asked about all the time, is the use of biologics. And when I say biologics, I mean things like PRP, which is platelet-rich plasma, or bone marrow derived stem cells, and even some of the newer things like gene therapies. So there's a lot of advancements in the treatment of orthopedic conditions, whether it's arthritis of the knee or a disc problem, all the way through to shoulder issues and rotator cuff problems. The technology in that area continues to evolve, and it's really exciting because it may get to the point where we're able to save people from really invasive surgeries. Already, we've had some really great results, and the data that's been published continues to provide guidance about what is helpful and what can be best used to help people get better. But one of the benefits of biologics is it uses your own body to heal. You can do it in a minimally invasive way, whether it's with an ultrasound or an X-ray. The downtime's much less. Instead of having a surgery where your downtime is 6 weeks or more, the downtime is usually not more than a week. So I think that these kinds of options really offer patients a huge avenue that they previously didn't have access to. And as they become more commonplace, the folks that will hopefully benefit the most will be the patients. And so I think we're really excited to be on the forefront of those kinds of therapies. And we've been fortunate enough to participate both with some clinical trials that look at these therapies, but also offer them in our clinical day-to-day practice and really help patients get better faster.
Yeah, I believe the natural approach is always the best because it's utilizing your own body to heal, and there's less chance of any types of rejections or issues when your own body is doing the healing.
In this practice, we also do implantable therapies, meaning that we use various devices to treat more chronic painful conditions, typically nerve pain-related conditions. And we've come up with a whole host of procedures that now can help people who really didn't have abilities to get better in the past. So for example, a lot of the patients we see have arthritis of their shoulder. And the older you get, the harder it is to have a shoulder replacement. That's a big surgery that requires a very long and protracted recovery time. We're now able to peripherally stimulate one of the small nerves in your shoulder. And by implanting this small wire, it's like a pacemaker, but for that nerve, under X-ray or ultrasound, we've seen incredible outcomes where people are getting 60 to 80% better for years after this. They're getting function back, movement back, and their pain is reduced, really giving people quality of life back.
That's very impressive. How long do these results typically last, Dr. Desai?
Yeah, I think that's a great question. I think in some cases, we're doing treatments that are really intended to help facilitate improvement. I look at the vast majority of what I do as a technique to facilitate improvement. Some of it is about giving people power back over their problem. And that involves a whole host of people, whether it's physical therapy, whether it's myself, whether it's other people that can help them. Because ultimately, the more people are able to do the less likely they're going to come back and see me. And what I mean by that is the more they're able to do their exercises, the more they stay active, the more they do their home exercise program that their physical therapist gives them, the more likely they stay away from having to see me. In certain cases, we're doing things that are more curative or things that are going to help big picture long term. So biologics are one example of where we might be able to cure the patient. And the other option, or the other example, is when we use some of these implantable therapies, like I described, using different techniques to place, for example, an electrode or a wire along a nerve, which can really help resolve the issue for the long haul.
Dr. Desai, you're recognized as a top doctor throughout the not only Washington, D.C., Northern Virginia region, but you are also recognized for offering and consistently providing excellent patient care as well. And you've really established an impressive practice located not only in D.C. but Northern Virginia as well, very convenient locations for patients. Can you tell us a little bit about your vision for the practice and what you feel separates you from a lot of the other practices out there?
Well, I think that, first of all, that's an enormous compliment on the part of the patients. They're putting their trust in us to take care of them and their families and their friends. One of the things we've noticed over the last several years is that instead of doctors referring us patients, which continues to happen, the number of friends and families that refer their other friends and families to us has increased exponentially. And again, that's an enormous compliment. As I said previously, I think it's important to us to consider the patient experience. And we really want that experience to be as optimal and as ideal as possible. Not only do we want to make sure that we're timely and that we make access available to patients, but we want to make sure that we help educate and provide them the best options that are possible. You know, when I previously practiced, prior to starting this practice, I was lucky enough to observe some of the things I thought worked and others that didn't work as well. And we've worked really hard, and a group of us have worked tirelessly here in this practice to establish this interdisciplinary type of approach where we have various people under one roof that are able to collaborate and to help patients continue to improve and be a part of their treatment journey. Really, because it is a journey. It is a process that takes you from point A to point B, and the more we can do to help get you to point B faster, the more likely you're going to stay at point B and be happy with the results that you get. And I think by putting the patient at the center, at the middle of this entire experience, that's really been our philosophy from day one.
Well, it's very impressive indeed. You offer a comprehensive approach here at your practice, which goes from not only treating the injuries, physical therapy, nutrition. Can you tell us a little bit more about that aspect?
And we're very excited about that. That's an area of the practice that's grown tremendously. We've sort of recently rebranded it as the Performance Lab, looking at patients from the perspective of what their daily performance should be. So there are patients who come to see us who just want to be able to play with their grandkids. And there's others that come see us that want to be able to run competitive races. And we need to look at each of those folks individually and evaluate their needs on a one-on-one basis. And by having these folks under one roof, whether it's physical therapists, whether it's a nutritionist, we have two offices in Arlington, Virginia. One is very much a physician office. The other is a physical therapy and wellness office. We really have the ability to look at patients from this sort of comprehensive approach. And the Performance Lab has been a part of our practice that's really grown very tremendously. And we get such great patient feedback about it. And patients really appreciate having all those folks in one place. And really the time and energy that those specialists spend with the patients is really commendable.
Dr. Desai, another issue or health problem that people suffer from, and there's so many of us that get this all the time, and that's migraines and headaches. What do you offer here at your practice that can help people with that?
That's an area of our practice that's grown considerably over the last year or two. There have been significant innovations in the headache space recently, new medications, new options for patients when there really weren't any new options for many, many years. We have an entire part of our practice that treats migraines and headaches. We do everything from Botox injections for headache and migraines in the office, all the way through to using these newer medications that became available over the last year. In addition to that, we have a whole part of our practice that works on infusion therapies. We offer them for both migraines, but also some other chronic painful conditions like complex regional pain syndrome. And this is a therapy where a patient comes in from anywhere from an hour to several days for several hours and gets an IV and gets a medication infused through their veins into their body. There's a lot of emerging data about the utilization and the effectiveness of these kinds of therapies. And it's something that we're really excited to offer patients, especially when you couple it with the experience that they have, which is a very private, quiet experience, and making sure that they're really comfortable and sort of shepherded through that process as effectively as possible. It's an area that we've really made a tremendous amount of growth in.
So it really fits well with all the other services and procedures that you offer, so you offer a total solution for a lot of these patients.
Yeah, absolutely.
Dr. Desai, is there any other treatment that you'd like to talk about that you feel or you're excited about that are cutting edge that are out there?
I think that pain medicine really is at the cusp of a lot of change. I mean, we're really excited about where pain medicine is going. There's been growth in the minimally invasive spine area, where pain medicine has really evolved into that area. There's a lot of technologies that are now available at a much smaller size in a much less invasive manner that we have access to that we didn't as recently as 5 years ago. I think where pain medicine is going is a little bit like where cardiology went. It went from being cardiology to interventional cardiology. And it's a lot of what we're doing as well now. We're using these small devices, small treatment options that really have a much smaller footprint and therefore allow patients to recover more easily without as much of an invasive surgery or procedure.
That's very exciting. I mean, there's so much going on. It's come so far from where the surgeries were and where the treatments and procedures were to these advances that you've talked about, much less downtime, minimally invasive, a natural approach that utilizes your own body's healing properties to help heal. It's really come a long way, and it's very impressive. And I want to thank you so much for being a guest today. It was a very informative interview.
Well, it's really a privilege to be at the forefront of a lot of those developments, and thank you very much.
Well, you're doing great work, Doctor. Thank you.